joining us. Next slide. So I'm Dr. Dennis Goodman. I'm a clinical professor in the Department of Medicine and Director of Integrative Medicine at the Leon H. Charney Division of Cardiology and the Center for the Prevention of Cardiovascular Disease. And these programs are part of our prevention center. We're very proud of them, as I'll tell you in a moment. Next slide. A little bit of logistics. We take questions. We welcome the questions. So if during the talk you like to ask a question, if you go to the Q&A, you can type in your questions. I'll be fielding them during the talk, and I'll take as many as I can. We've also received a lot of questions, and I'm doing my best to answer as many as possible. Next slide. So the upcoming lectures are, and we'd like you to diarize these for American Heart Month, which is in February. We have Women's, could you go back, Anya? Women's Heart Health Month, it's understanding your risk. We're going to be focusing on women's heart health, but of course, most of it is relevant for men as well. And so we welcome you all to attend that on Tuesday, February 28th at 5 p.m. And then on Tuesday, that's actually a mistake. I'm sorry about that. High blood pressure, all you need to know to prevent heart attack and stroke. That's in March, and I'll get you that date as soon as by the end of the program. I'll give it to you. So to register for these programs, it's nyulangone.org/heart health lectures. Next slide. We've had many lectures in the past, over 215, and over 50 lectures since 2015. And as you can see, many topics: microbiome, healthy weight, sleep, blood pressure, pre-diabetes, aspirin, and we're very focused on prevention. As you know, I like to focus all our lectures on ways for you to be healthy and stay healthy and prevent recurrence of any cardiovascular problems. Next slide. We're very proud of the fact that we've had over 78,000 views of our lectures on YouTube. We have a lecture library. You can go back into the archives, and many of these lectures have been recorded. So I gave you the web address where you can get all the information you need, and also a link to the YouTube videos. Next slide. So here are ways to keep in touch with us: through the website, through email, through Twitter. I think most of you know how to do that now. That's how you've been able to sign up for our programs. Next slide. And here's an address where you can get all the information you need: nyulangone.org/heart health lectures. Next slide. So tonight, it's my honor and privilege to introduce a fantastic speaker and one of our favorite cardiologists here at NYU. He's part of our cardiology department. He's an associate professor in the Department of Medicine and an associate professor in the Department of Population Health. He's director of the NYU Cardiovascular Digital Health Lab, and he's director of the Geriatric Cardiology Program. He did his training at Yale in geriatric epidemiology, and he focuses his clinical practice on geriatric cardiovascular disease and helps people to get through all the challenges of being what is old. I mean, it's anything older than you are. So John is one of our absolute favorites, and we welcome you to speaking tonight. Next slide. The topic tonight is anti-aging strategies and treatments. What's the hype? So welcome, Dr. Dodson, and thank you for picking up this very, it's a very popular topic. It's so controversial that we could do a 3-day seminar on this topic, but I really appreciate you just touching on the main points and taking some questions afterwards. So welcome to our lecture series, and thank you.
And thank you for that introduction, Dr. Goodman. So I'm going to try to cover a lot of ground in this talk. As Dr. Goodman alluded to, this is a very extensive subject, and so this is going to be a broad overview. In my position, so I'm a clinically trained cardiologist. I also trained in geriatric epidemiology, and I direct our geriatric cardiology program here at NYU. And so aging is something that I both study and also see on a regular basis in my own cardiology practice. Next slide. So here's an outline of my talk. I'll briefly discuss some of the biology of aging, and then I'll discuss some specific anti-aging strategies that might broadly delay aging. And here I'm going to focus on strategies rather than a specific disease, focus on broad anti-aging topics. So for example, in my own field of cardiology, I'm not going to be discussing aspirin, which is beneficial in patients with established coronary disease, but not in the population at large. And so we're going to focus on these broad anti-aging strategies that might apply to everyone. Next slide. I'll start with some background. Next slide. Here's a single slide that I use in a lot of my talks, and I think this illustrates very well the complexity of the aging process. So on the left is Nancy Pelosi, until very recently was Speaker of the House of Representatives, and she's currently 82 years of age. And then on the right, we have somebody who's the same age, but this person is in a wheelchair in a nursing home and has a lot of requirements in terms of assistance with her daily activities. And when I'm rounding on the inpatient service, I see people on the right all the time. Yet these people are the same age. And we know very little about the aging process and why some people age well and other people do not. And so this brought me to this field in terms of research and trying to understand some of these differences, as well as integrate some principles of anti-aging into my own clinical practice. Next slide. So as I mentioned, we have limited knowledge about why people age at different rates, but we do know that there are both lifestyle and genetic factors that underpin the heterogeneity of aging that we see. And one way to think about this variation is this concept of homeostasis. Homeostasis is essentially the process that living things need to actively maintain the conditions needed for survival. So this includes anything from temperature regulation to how the body heals after an injury. The body has a certain set point, and homeostasis is its ability to return to that set point. For example, when it's cold outside, maintaining your body temperature. When you get a cut, the ability to heal that cut and maintain normal conditions. And a key research point in geriatrics is that homeostasis declines with aging, but it also declines at different rates. And so some people, older people, respond very badly to infection. For example, they're hospitalized and have very severe courses, much more common in the younger patients. And again, this is a problem largely of homeostasis. But again, different people at the same age have different degrees of impairment in homeostasis. Next slide. So it's also worth noting, which I see as a cardiologist and anybody who's practicing medicine is well aware of, most diseases increase exponentially with age. So two major diseases in the US, heart disease and cancer. If you look with age, they increase with every decade. And so any intervention that targets the biology of aging, in theory, would be able to delay multiple diseases at once. And this is an important point, and I think this is why intervening on the aging process is something that's very appealing to people when they're thinking about interventions. Next slide. So there's also this concept of aging well, which essentially means surviving physically and cognitively intact into old age. In people who age well, their homeostasis remains relatively intact, and therefore they have resilience when faced with a physiologic stress, such as an infection. Falls are another example. People bounce back relatively quickly. Advance, next slide. What I did in preparation for this talk was I just looked up aging well on Amazon, and I found not just these books, but many others on this topic of aging well. And actually the one at the bottom right was written by one of my early mentors who's up at Harvard. These books run the gamut, though, from science-based strategies to age well versus many other things that are not necessarily grounded in hard evidence. What I would say is that none of these books has a complete answer, because we're still trying to figure out who ages well and exactly why. Next slide. So what some people have done is looked at specific populations that age well. Some of you may have heard of this island of Okinawa in Japan. I had to look on a map, but it's in southern Japan, so it has a relatively warm climate. It's been written about in both the scientific literature and the popular press. This was in National Geographic in 2020, and there was a more recent article as well on Okinawa. And it has one of the world's oldest populations, and people there tend to age without developing many of the major diseases that are seen elsewhere. And so this is why it's been so interesting to try to understand Okinawa. Next slide. In this article, they noted that at the latest count, 15 of Ojimis, which is a village on Okinawa, 15 of the villagers are centenarians. 175 are in their 90s. And even in Japan, which currently has more than 70,000 people aged 100 or over, that's a remarkable statistic. And so Japan has the world's oldest population. Okinawa has the oldest population in Japan. And there's something about Okinawa where these people age exceptionally well. Next slide. There are multiple theories behind this exceptional longevity. It's still an area of active study. But proposed factors include genes which lower Alzheimer's risk. For example, there's a lower prevalence of the ApoE4 gene. Although Alzheimer's is complex in terms of the biology, lower prevalence is thought to be one factor. But they also have lower rates of smoking, a high rate of physical activity. They have a low-calorie diet, and they also have a very active social life. And I think to this last point, socialization is something that we need to pay more attention to in our clinical practices as cardiologists and also among other healthcare providers. And even before the pandemic, I had many older patients in my own practice who lived alone. They had very few social contacts. Maybe seeing the doctor was the only time they got out all week. And then COVID-19 hit, and many of these bonds were broken. And so even regular doctor's visits, everything went online. People might have had one or two social contacts. They couldn't see them. And so this, I think, made things remarkably worse. And there's an emerging literature on how isolation, social isolation, can lead to things like cognitive decline and actually premature aging. It's very hard to intervene on this. It's not something that I can say to my patient, here's a pill to take. But it's still something that I try to be mindful of, and I try to encourage my patients to maintain or make social contacts. Not always easy, but it's something that's very, very important. And in populations like Okinawa, they maintain socialization into a very old age, and that's thought to be protective. Next slide. So since this is the title of my talk, I also wanted to, hype is in the title of my talk, I wanted to pay attention to this concept before getting into specific anti-aging strategies. And what I've cited here is a review published earlier this year. And I quote, "There are many drugs, supplements, and other treatments that are marketed as anti-aging and can be accessed direct to consumer from pharmacies or online. This global anti-aging drugs market is estimated to be $82 billion in 2020. However, none of these treatments can support their anti-aging claims with high-quality clinical trials equivalent to those that are required for the registration of drugs for the treatment of individual diseases." And so you can, again, go to Amazon and look up anti-aging supplements, and you will find hundreds, if not thousands, of things that claim that they can delay aging. We don't know if they can. That's the bottom line, because they haven't been tested in terms of large studies, which are required for drugs and that are approved by the FDA. And so again, this is an enormous industry, and there's a lot of confusion when people, people ask me, should I take this supplement? Does this work to prevent aging? My answer is there's simply not enough evidence for most, if not all, supplements. Next slide. I'm going to move on to what does have scientific evidence that's been published in literature. And in the interest of being specific as possible, I wanted to go over what you can do if you're interested in anti-aging strategies. So the first one here is exercise. Next slide. And I think this article sums it up nicely. I've cited it here at the bottom. It states that individuals who engage in regular exercise live at least 3 years longer than sedentary counterparts. Therefore, exercise may be considered the most effective, accessible, and cheapest therapy a physician can prescribe. Next slide. So this is actually me. I initially gave a version of this talk in the fall. This is me with my dog. As I was preparing the talk, I literally went out and ran every day for a week. because I was so influenced by the literature on exercise after I read it more in depth. I tell my patients all the time to exercise, but there's a very robust scientific evidence behind delaying aging. I still try to maintain this even in the colder weather. And again, there's very, very good evidence, something that's available to us and has again, a solid foundation. Next slide. There are multiple ways in which exercise can delay aging. So it acts on the heart, but other systems, as I've shown here. So it acts on the neurological system. It acts on the endocrine system, the musculoskeletal system. There are oncological benefits. And the whole effects on the body are key in slowing the aging process. Next slide. So what is it that people should actually do in terms of exercise? You can actually advance, Anya. Okay, what they recommend on their website, if you look at AHA guidelines for exercise, is 150 minutes per week of moderate intensity aerobic activity or 75 minutes per week of vigorous aerobic activity. What do these mean? I've shown at the right examples of moderate intensity aerobic activities. This can include a brisk walk. Walking is the easiest thing to do, as long as you live in a walkable area or you have access to a place you can walk, like a mall or somewhere else. Water aerobics, dancing, gardening, these are all moderate intensity aerobic activities. Vigorous activities, as expected, are more vigorous. So running, swimming laps in a pool, aerobic dancing. I tell my patients 150 minutes per week. That's 30 minutes a day for 5 days. They can rest on the weekends. Brisk walking is the easiest thing to do. And again, there's very good evidence that 150 minutes per week is beneficial in terms of heart health. Next slide. I wanted to show this here. This is from the Washington Post back in October. And there's emerging evidence that simply taking enough steps can prolong your life. This is kind of similar to the concept of taking a brisk walk. Walking is very, very good in terms of cardiovascular fitness, lower extremity strengthening. And what they did in this study was, this was in the United Kingdom, where, next slide, they had a study of 78,500 people at an average age of 61 years. And then they followed them forward. So these people all had monitors to see how many steps that they took. And what they found, what I showed on the x-axis is total steps per day. What I showed on the right is, on the y-axis is risk. So risk is going down with more steps. But what's really interesting here is that this curve tends to flatten around 10,000. And so this is one of the reasons that you hear this 10,000 steps thrown around, that you should get 10,000 steps a day, because people in the study who had 10,000 steps per day had a lower risk of mortality overall, and both due to cancer and heart disease, and they were followed over a period of 7 years. And so your phone tracks you, your activity. If you have an Apple Watch or Fitbit, they track your activity. It's an easy thing to measure, and 10,000 steps has a real effect. If you just wanted to walk, that's an easy way to get this done. Next slide. So I'm going to move on to diet. Diet is a little more complicated, but I think also important to discuss. Next slide. And I'll be honest by saying this is a standalone talk or maybe a full day course in terms of how diet influences the aging process. And what I would say, you can advance, is that there are many diets that claim to be anti-aging. Again, this is quick Amazon search. I've shown this at the right, but again, it's difficult to separate out what's based on evidence versus what's simply the next dietary fad. Next slide. So this is a recent review of the topic. This is in the journal Cell, which is a top basic science journal. And it's one of the most up-to-date articles. If anybody's interested in reading, it's technical at various points, but I think provides a very good overview of what we know about nutrition, longevity, and disease. Next slide. To summarize, what they did in this paper was they reviewed several longevity diets, including a low-protein diet, a low-carbohydrate, or also known as a ketogenic diet, vegan diet, low-fat diet, and high-fat diet. Next slide. And what they found was that the everyday normal caloric longevity diet associated with extended lifespan and health span is characterized by a mid to high carbohydrate and low but sufficient protein intake that is mostly plant-based but includes regular consumption of pesco, vegetarian-derived proteins. So to translate, that means that mid to high carbohydrate, sufficient protein intake, so not excess protein, but sufficient protein, and that protein should mainly be through fish or vegetarian sources, which would be beans, tofu, other products to maintain adequate consumption of protein is the best diet in terms of longevity. Next slide. They also noted that a sustained change from the typical Western diet, as people know, is high fat, high sugar, and high in things like red meat. So changing from the typical Western diet to an optimal diet rich in legumes, whole grains, and nuts with reduced red and processed meats is associated with an increase in life expectancy of 10.7 years in females and 13 years in males if started at age 20, and over 8 years of increased life expectancy when started at age 60. So what's really important here is that even in age 60, adopting healthier dietary habits can lead to extended lifespan. Very important point. Next slide. So I try to be as concrete as possible in my recommendations. I think when you get too complex about diets and you try to change everything in what somebody does, you're setting yourself up for failure. People develop patterns. They have certain recipes that they know, certain ways that they shop. So I do simple steps. So number one, cut out easily reduced sugars. So if they're drinking soda every day, that has to go. If they have other things that are high in sugars, breakfast cereals, a ton of sugar. Oatmeal, not a lot of sugar, but if you look at kind of, breakfast cereals, Frosted Flakes, that sort of thing, cut it out. Number two, cut down red meat intake. It doesn't have to be cut out entirely, but once a week, once a month, that sort of thing. Not a steak every night. We know that that's not good for you. Increase whole grain and vegetable intake. Again, doing things like switching to whole grain pasta, whole grain bread, making sure you have some sort of vegetable with dinner and other meals as well, if possible. Also, a simple, healthy change to make. And then number four is everything else. So for example, I have certain patients who need to be on low sodium diets. Not everyone needs to be on a low sodium diet, but certain patients, for example, if they're trying to manage their high blood pressure with diet, I will recommend low sodium in that situation. Also people who have difficult to manage congestive heart failure. But I do the first three in pretty much everyone in terms of my dietary guidance. I try to be simple and not overwhelm people with information. Next slide. So I'm going to move on to caloric restriction. So this is different from the kind of diets that I mentioned. It's a specific strategy for longevity, and it's received a lot of attention lately. Next slide. So caloric restriction is defined as a consistent pattern of reducing the average daily caloric intake. So for example, 75% of usual calories in a given day. This is different from malnutrition. So in caloric restriction, the strategy ensures that there's adequate nutritional intake. There's just not excessive intake of nutrition. So only what's needed, but malnutrition means you're not actually getting the nutrients that you need. One form of caloric restriction is intermittent fasting, which I'll mention. Next slide. So this has been studied quite a bit in animals, including non-human primates. The paper I've shown here is over 10 years old, but this was a landmark study in the field. This is in Science, which is arguably the top journal in terms of people who do laboratory research. And what they did was they put rhesus monkeys on a restricted diet versus a regular diet and followed them for a long period of time. Next slide. What they found among these non-human primates was that those who received caloric restriction, they're randomly assigned, had a low rate of death, 30% lower in terms of the absolute reduction in death. They had a lower incidence of diabetes, cardiovascular disease, cancer, brain atrophy. And what's most memorable from this paper is that they appeared subjectively younger. Next slide. So here's a figure from the paper. The monkey on the left received a normal diet, while the monkey on the right received caloric restriction. And we can see clearly that with caloric restriction, many of the hallmarks of aging, such as gray hair and poor skin turgor, are not present. Next slide. Intermittent fasting is one way that people use to practice caloric restriction. So essentially, instead of eating fewer calories at each meal, there are scheduled periods of eating little to no food. I've shown different methods that have been discussed. There's the 16 and 8 method. So that's daily fasting for 16 hours straight. So for example, skip breakfast, eat lunch and dinner within 8 hours of each other. There's a 5 and 2 diet, 2 days with minimal calories, 5 days with a normal diet. Some people fast for 24 hours once a week. This is actually, some people as part of religious practice do this, or alternate day fasting as well. Next slide. What I wanted to mention is that I have never recommended intermittent fasting in any of my own patients. This is not something that I regularly endorse. I don't think it's a good idea in older patients. These diets are very hard to follow. I think that the person who follows intermittent fasting is typically somebody who's my age, and they want to do everything they possibly can, and are very invested in this idea. I don't do it myself. I don't endorse it in my patients, but it is scientifically interesting to think what the effects of intermittent fasting could be. And people who are very motivated, who are, I think on the younger side, might pursue this strategy. Again, very difficult to follow. And I also have some patients who I actually don't want them to lose weight. I don't want them to restrict their diets, because weight loss at a very advanced age is also something that can be bad in terms of prognosis or susceptibility to injury or infection or other things. So again, very complicated subject, but I did want to touch on it. Last article on intermittent fasting I wanted to mention, this was in the New England Journal of Medicine in 2019. And they noted that there's lower inflammation and improved cholesterol levels with intermittent fasting among people who follow these diets. Next slide. Wanted to move on to metformin. In terms of medications, this has the greatest level of interest among scientists around its effects on aging. Next slide. So in the paper I've shown here, which was published earlier this year, the authors reviewed the evidence behind metformin and longevity, and they make a strong case for metformin as an anti-aging drug. Next slide. So metformin has been around for decades, and it's the first line medication for patients with diabetes. It's very well tolerated, it's cheap, and it's very effective. And how it works is that it increases sensitivity to insulin, but it also has other effects. So it decreases what's called oxidative stress. This is something that is known to damage cells. It decreases inflammation. And when looking at people who take metformin, studies have shown reductions in mortality, cancers, cardiovascular events, and dementia. Now, these are studies in people who happen to take metformin for diabetes, but we don't really know how metformin would work in healthy people. We don't prescribe it to healthy people without any disease. However, there are multiple benefits metabolically of metformin that have been shown in patients with diabetes. Next slide. So what some people have done is actually advocated for metformin as an anti-aging drug, which means it could be prescribed to healthy older people without diabetes. And the idea would be that metformin would delay the onset of multiple diseases at once. One of the issues is that the FDA, to give labeling to medication, needs to define something as a disease. So diabetes is a disease, high blood pressure is a disease. There's no FDA indication for aging as a treatable disease. Aging is just something that happens. Many diseases are related to aging, but you can't get FDA approval for an anti-aging drug. It's just not what they do, at least right now. So this is one of the challenges in terms of thinking about how to develop drugs for aging. Next slide. So this leads me to something called the TAME trial. So this is this person, the person I've listed at the bottom, Dr. Barzilai. He's in New York, and he's a researcher well-known who has been advocating for metformin and developed this idea for a study called the TAME trial. Now, it's not underway yet. They're in the planning phases, but the idea is to assign healthy older people to receive metformin versus placebo, and to see whether or not metformin has metabolic benefits and has benefits in terms of delaying the aging process. So I think this would be really interesting if it was done. We're not yet underway, but there is promise for understanding better how metformin might work as an anti-aging drug. Next slide. So there are other medications under investigation as well. I'm showing them here in the interest of time. I'm not going to do a deep dive into these medications, but the take-home point is that these medications are an active area of research. They may act on the aging process in various ways, and you may see them coming down the pike in terms of research studies that use these drugs to try to inhibit aging. Next slide. I finally wanted to mention blood pressure control, since there's emerging evidence that it not only improves cardiovascular outcomes, but it has other benefits as well. I see hypertension all the time as a cardiologist. Next slide. And there are decades of evidence about the cardiovascular benefits, and the newest blood pressure guidelines state that we should aim for a blood pressure of less than 130 systolic over 80 diastolic. What's interesting about this is that there's also emerging evidence that blood pressure control doesn't just affect heart disease and heart attacks, but there's also fairly good evidence that it helps to prevent cognitive decline and dementia, which I'll show. Next slide. So the National Institutes of Health funded a trial called SPRINT, and SPRINT was a large blood pressure study focused on aggressive versus more conservative blood pressure targets. And what this study did was, it was part of SPRINT. It was called SPRINT Mind. And they looked at cognitive outcomes in people who had more aggressive versus less aggressive blood pressure control. Next slide. So there was an intensive group with a target of less than 120. There was a standard group with a target of less than 140. That's what we all used to do. And what they found was that intensive blood pressure control led to lower rates of mild cognitive impairment or probable dementia. So there was a significant reduction in those outcomes if people had more aggressively controlled blood pressure. There was no reduction in dementia alone, but again, these numbers were smaller than this combined group of what's known as mild cognitive impairment or dementia. The difference between mild cognitive impairment and dementia is that mild cognitive impairment means your daily function is intact. You can still do what you need to do, but you might not know where your keys are. You might not be able to draw a clock. Certain things are impaired. Once dementia is present, there's an impairment in something, being able to drive, being able to dress yourself, that sort of thing. In any case, intensive blood pressure management appears to be beneficial here. Next slide. So in summary, we've seen that aging is a heterogeneous process that's partially due to genetics, but also with a strong lifestyle component. There are several either proven or promising strategies to slow the aging process. These include exercise, diet, caloric restriction, and aggressive blood pressure control. The last of these can be difficult to follow, and it's not something the caloric restriction can be difficult to follow. I think the other ones are easier to follow. Caloric restriction is difficult to follow. It's not something I recommend routinely in my patients. There are no medications yet, but this is a very interesting area, especially around the question of metformin. So in my opinion, it's a great time to be involved in the field. I'm glad that I chose to be an aging researcher and that I have this geriatric cardiology practice where I'm seeing these patients on an everyday basis. Next slide. I think this slide was added to my talk, so thank you, Anya and Dr. Goodman. Just wanted to mention our geriatric cardiology program, which is here on the NYU main campus. So I do see patients for new visits, often second opinions. Generally, my practice is over 70, not everyone, but I try to implement what I gave in this talk on a daily basis in terms of healthy habits to delay aging. So I'll stop there and I'll take any questions.
Thank you very much, Dr. Dodson. I know that you have to leave a little bit early, so I've picked a couple of questions for you, and then I'll answer some of the questions at the end. But I think you've covered some of this stuff, but I did pick these questions before, and I hope you can tackle some of them. I'm almost 80. What's the optimal amount of cardio I need to do each day or per week? And I think you mentioned that, and I think one of the issues is, can people do that amount of exercise? It's not that easy. And I think the point that we should make is that whatever you can do, those are optimal and ideal recommendations. But even if you can get out and just walk for 10 or 20 minutes a day, that's definitely better than nothing. I don't know if you want to comment on that.
Yeah, I find the 150 minutes challenging, to be honest, in somebody who's 80 or 85 and has limited mobility. It's very, very hard to make 150 minutes a week. And so if somebody says, is it 150 or nothing? The answer is no. The more you do, the better. And I think I try to set realistic expectations. So start with 30 minutes 3 times a week. I think for people who are, generally indoors, I try to get them to go outside, take a walk around the block, that sort of thing. 30 minutes 3 times a week still does a world of good. walking is the easiest thing to do, but there's lots of other activities, you know, especially as the COVID situation is improving, gyms are reopening. Some people have access to pools. Any activity that they can do is good.
Okay, great. Next. How can I overcome the challenges of aging so that I can manage my daily chores? I think you tackled some of the things that we have to do and start as soon as you can. But I think that's just a very good question. It's what are the challenges of aging, Dr. Dodson?
Yeah, this is a very difficult question to answer. I think it's not something that is you know, easy to kind of give a simple response. You know, it's there are lots of challenges of aging, right? And it's not just developing the diseases I mentioned, but things like arthritis. I mean, you know, many patients in my practice have problems with arthritis that makes it difficult to do things like ambulate, to lift heavy objects, that sort of thing. So and again, some of it is things like, you know, pain management if people have arthritis. Some of it, honestly, is leaning on a partner or caregiver. If somebody's unable to do those chores anymore, some of my patients hire help. Some of my patients have their partner do chores that they used to, you know, so there's intervention and then there's accommodation. And they're two very important strategies, I think, as people age.
I absolutely. I think getting as much help as you can for things that you can't do, but trying to do as much as you can. And I think being mobile and getting out and doing some walking, some stretching, just, you know, moving your limbs is so important to keep as flexible as you can so that you can avoid some of these challenges. So I know there are lots of classes for elderly patients, and I always encourage people to try to sign up either with a class or maybe you with a trainer, somebody that can work with you that's used to geriatric patients, because there's no question in my mind, the patients of mine that can do that are so much better off and they enjoy life so much more than being limited by disabilities, especially from, as you said, things like arthritis. Next one. I tend to sleep about 6 hours per day. Is this harmful as I age? Maybe you can comment on what happens with aging and sleep and how important sleep is.
Also a very good question. So the American Heart Association used to have something called Life Simple 7, and they were the 7 things that you should do for your heart health. And they just changed it to the essential 8. And the reason it became 8 instead of 7 is because they added sleep as one of the essential components of heart health. And the more we understand about sleep, the more we realize how important it is for not just mental health, but also metabolic health. People in general should sleep 8 hours a night. That's easier said than done, especially in older people, because what I find is that people either have difficulty getting to sleep or they wake up early in the morning or both. And so what I advise my older patients to do is to take a nap in the middle of the day. So if they're waking up early and they can't get back to sleep, it is perfectly acceptable to nap for 1 or 2 hours. And part of the biology of aging is developing a more bimodal sleep pattern where you don't just sleep at night, but you actually need to sleep during the day. I mean, it's similar in children where they actually need to take a nap in the middle of the day. There's something about the aging process where sleep is twice a day instead of once a day, not in everyone, but if somebody's sleeping 5 or 6 hours a night, I tell them take a nap after lunch. Perfectly appropriate to do so. And I try to advise people to get at least 8 hours of sleep a night.
Thank you. How reliable are telomere length tests on predicting biological age? Just before you answer that, I think we should just tell people, you know, what is a telomere? It became very popular, a lot of research being done, the whole issue of what is a telomere and how does it affect aging. And what we know is that the telomeres are really the end part of your DNA in your chromosome. And the best analogy is if you take the shoelaces and you have a little plastic cap on the tip, on the edge of, on the end of the shoelaces that protect the shoelace from fraying and actually getting shorter and not being that functional. That's what a telomere is. And there's been huge amount of research showing that if you can keep your telomeres from shortening, that you're likely to live longer and protect your body from and your cells from breakdown. So I'm going to ask you to answer that, and then I'll comment about, you know, there's so many claims out there. You mentioned it. There's so many claims about supplements that are increasing your telomere length. And the fact is there's no data, there's no scientific data from these supplements that they increase longevity. And I know people are taking them. Some of the supplements that have been shown to preserve telomere length, like folate, B12, vitamin D, vitamin C, fish oils. There's a Chinese herb called astragalus. We don't have the information to recommend them on as something that's going to increase your longevity based on the telomere length. But it is a big area of research. I'm interested in whether you feel it's reliable to even test for it.
Yeah, so I think you explained it very well in terms of the shoelace analogy. That's a good way to conceptualize it. There are these repetitive nucleic acid sequences at the end of your chromosomes, and essentially we know that telomeres shorten with age, and that's part of the aging process. And there are companies that are marketing this. If you look up telomere tests, you can do this at home. My question with these tests is what to do with the information. So I can't imagine advising something different based on the test results. And that's the thing, right? So I want somebody to eat healthy. I want somebody to exercise. I want somebody to socialize. I want somebody to quit smoking. I'm not going to say anything different based on the results of a telomere test. And so part of me thinks, well, you know, you could get this test and just feel bad about it, right? If the test says like your telomere length is very short, you know, your biological age is old, like what, like I can't imagine recommending something different, you know, do less healthy behaviors, right? Or push yourself harder. In most of my patients, the recommendations don't change. So again, I think that this is something that's being marketed to people. I don't think there's great utility yet. It's certainly interesting in terms of the biology, but I can't see great value. It's certainly not something I recommend my patients go out and get, but some people are going to get them because they're interested in having that information.
Yeah, thank you. You know, when I saw this question, I actually wrote down what we do know, and it's really about what you spoke about. We do know that a low-fat diet, a low caloric intake, a diet rich in fruits and vegetables, legumes, nuts, whole grains, plant proteins, plus moderate exercise, good sleep, no smoking, minimal or no alcohol intake, and stress management actually preserve the length of the telomere better than supplements or drugs at this moment in time. So I think it's going to be an area of research that's going to be very prolific. But at this time, as far as we're concerned, I think you want to stick to the lifestyle changes that we're speaking about as something where there's some evidence about preserving telomere length. Next slide. I'm about to let you leave. I think we've got one more question. How does aging affect the valves of the heart, Dr. Dodson?
That's something that is also interesting in terms of the biology. So not every patient has aging of their heart valves, but a lot of them do. And the valve that's most effective is called the aortic valve. The aortic valve is the valve between your heart and the rest of your circulatory system. So it's between your heart and your aorta, which is the large vessel that carries blood everywhere else in your body. What happens as you age, or as a lot of people age, is that valve becomes stiffer and it gets calcium on it. And some people can develop a condition called aortic stenosis. What I had mentioned earlier is that most diseases are diseases of aging. Aortic stenosis is certainly a disease of aging. So some people in their 70s and 80s or even their 90s have so much stiffening of that valve that they need the valve to be actually replaced. We don't know exactly why it gets stiff and develops calcium on it. It's something that we just see all the time. And as people age, they just get these calcium deposits. People can get deposits on other valves. The consequences aren't so severe in terms of what we see with the aortic valve, but there are definitely changes in the heart as people age, and getting calcium on the aortic valve is one of those changes.
Next slide. What's the role of metformin in preventing Alzheimer's? What about probiotics? You mentioned metformin. You said we really haven't reached the point of recommending it for people that are healthy or that don't have metabolic syndrome or diabetes. But what do you feel for people who have a high risk of Alzheimer's, and what about probiotics?
Yeah, so there's a study underway at Columbia looking at exactly this question of metformin and Alzheimer's prevention. And there might be other researchers working on this as well, with the hypothesis that metformin can metabolically delay whatever changes and therefore prevent Alzheimer's disease. And so I think we'll know more in 5 to 10 years. Right now, it's not something that I would endorse in my patients. And I don't tell healthy people to take metformin, but I do know other physicians who are more aggressive about recommending it, especially in these patients who have kind of like pre-diabetes, so their hemoglobin A1C is 6, and maybe they're a little overweight. I do know people start metformin with the idea that there are metabolic benefits and other benefits, and things are still being teased out, but it's an area of active research. The probiotic question, I'm going to bounce back to you, Dennis. I actually have no experience with probiotics, and so it's not something that I feel qualified to weigh in on.
Well, I mean, the issue with probiotics is clearly we want the microbiome is so important today, and you want a healthy microbiome, and the best way to have it is with a healthy diet. And I do recommend probiotics when people are taking an antibiotic, and I do recommend probiotics when people have issues with absorption or GI problems like irritable bowel syndrome and things like that. But we don't have data that probiotics are going to actually reduce the incidence of Alzheimer's. I've got questions here about milk, and one of the reasons that they do so well in Japan may be that they're not drinking they don't do dairy. And do you have any comments about that? We're much better getting calcium from leafy greens. And unfortunately, most of the calcium that we get does come from dairy, and there are some people who don't do well with dairy, but I don't think there's a problem with having dairy as long as you are not somebody that has sensitivity to it, and it can be inflammatory in some patients. So what do you think about dairy products?
Yeah, I don't recommend against it in my own patients. It is an interesting question. What I find is that people develop lactose intolerance as they age, and so that's one of the limitations to dairy. But it's not something I recommend people switch out for something else, especially if, I have to balance some of the healthy diet recommendations. Also, as I had mentioned, as people age, it's important that they maintain weight. And so what I don't want people to do is restrict their diet so much that they can't eat anything that's pleasurable to them, and then they lose weight, because we know that weight loss at an older age, and I'm talking in your 70s and 80s, too much weight loss is bad. So if you lose more than 10 pounds in a year, that's actually a risk marker for bad outcomes in terms of fractures and other things. And so dairy is in cheese, ice cream, a lot of other stuff. And so I don't say cut out dairy entirely in anybody. Maybe somebody who has stomach upset, gastrointestinal distress, it's something that they would cut out for that, but I don't recommend cutting it out for those inflammatory effects. Others may feel differently, though. It's a very interesting question, I think.
And just the last question comes from one of our very regular attendants is Stephen Ho, and he said, Dr. Dodson, did Dr. David Sinclair at Harvard's research inspire you to get into this field? Any comment on his view that defects in DNA packaging is underlying aging? So
the person that influenced me at Harvard was actually Dr. Sue Levkoff, who was a she researched socialization and aging. So I kind of came at aging from the angle of aging in society, rather than from the cellular biological level. And some of her work actually was in, I think she did a study in Japan, and this was like back in the 1990s, before everybody was talking about Japan and why they aged so successfully. So I was interested in the heterogeneity of aging and how to maintain aging through socialization, mental health, that sort of thing. Again, very hard in our medical practices to intervene on, but I think very important, and I think doesn't get enough attention in terms of the epidemic of social isolation and how that can affect the aging process. So I think with that, Dr. Goodman, I'm going to go. I have hospital responsibilities, but this has been great. And thank you so much for the invite.
Thank you very much for that excellent presentation and for taking all the questions.
Bye-bye.
I'll say goodbye. So I'm going to just focus on one or two other questions that have come in before we end off. But I wanted to go back to something that Dr. Dodson touched on, which was the whole issue of socialization and how that actually can impact aging, longevity, happiness as you get older. And I want to recommend a TED talk to all of you. And the topic is What Makes a Good Life by Dr. Robert Waldinger, Waldinger. You just go on Google, type in What Makes a Good Life, and you'll see the TED talk. And in 12 minutes, you will actually get the whole story. And what it actually talks about is the Harvard study of adult development, which is the longest study that we have in following adult development. It's over 80 years now, and it started in the 1930s, and it involved 724 men, half of them at Harvard, mainly sophomores, and half of them from the inner city of Boston. And what they did is they followed these people, and they looked at what are the things that are most likely to contribute to aging well and being healthy in your old age. And obviously they were expecting the usual, that people who have good genetics, or people who eat properly, intelligence, high IQ, people who are exercising more, people who are financially successful would be doing better. And what they actually found out that it's really mainly about one thing, and that's being socially connected to family and friends. Loneliness is something that kills and is actually toxic. So the quality of relationships is so important, and helps, we know for 100% sure now, and helps you to live longer and to be living and being happier. So what I found very fascinating is that people who are most satisfied with their relationships at age 50 was a predictor of how healthy they would be in their 80s. So there is a wonderful quote that says, there isn't time for bickering, apologies, heartburnings, calling to disagree. There's only time for loving. And for an instance, it's so to speak, the good life is built with good relationships. And I'm wanted to focus on that because I think many of us know elderly patients, and the one thing that we can really do is reach out to them and keep them connected. There's actually a partner that I have who started something called Lockdown University. Her name is Wendy Fisher. And this is something, if you look up Lockdown University, this is actually a program like a university where you can listen to a lecture every day, sometimes 1 or 2 or 3 lectures. And that's something that really helps people stay connected. And that's something else that I can recommend to you. I'll get you the exact way to get in touch with them, and it's free, and it's another way to get in touch with people. So let me see if I can just let me go back to the Q&A here. Is CoQ10 recommended for slow heart aging? I don't think that it's actually necessarily slow aging, but we do know that CoQ10 is very important. It works in the mitochondria. It's important for energy. And I definitely do recommend CoQ10 in patients who are taking statins because it lowers the CoQ10 dose. In terms of scientific evidence for this, it's been very controversial. And in fact, scientific evidence does not suggest you have to take CoQ10. But what I find in many of my patients who are on statins, when they take CoQ10, they tell me that they do feel better and they seem to have less pain, although we haven't been scientifically able to prove it. One scientific way to think about it is to actually measure your CoQ10 level. You can measure that in the blood, and if it's low, then you can supplement with CoQ10. The dose is 100 milligrams up to 300 milligrams per day. There has been studies that have shown that some patients with heart failure did well when they received a high dose of 300 milligrams of CoQ10 a day. Metformin, can it cause dry skin dryness and hair color change? I'm not aware of it. It doesn't have, as far as I know, those are not side effects of metformin. By doing the 16-8 fasting daily, I consistently get tested for the presence of ketones in the urine, which means the fasting is working. Is it detrimental? No, that is just a manifestation of what's happening when you're fasting. It's not that it's detrimental, but you certainly want to make sure that you don't have ketones all the time. You want the ketones to come when you're fasting. Do By low protein intake, do you mean daily intake of milk is bad? We discussed that. Vegetarian almond milk is better. Is it better? Are you better off drinking almond milk? Well, it's definitely if you've got lactose intolerance, you should be trying the almond milk or even oat milk, something that doesn't have lactose in it. Let me just... What constitutes a healthy blood pressure in women versus men? Should the systolic pressure be 110? It's very hard as you get older to get a blood pressure of 110 in men or women. I don't think it needs to be that low. In my patients, I try to aim for a blood pressure of below 140 over 90. When you start to try to bring the blood pressure down into low levels, that means multiple medications and more side effects. So unless there's a patient who has diabetes or they have kidney problems, I try to maintain the blood pressure below 140 over 90. What supplements? I think, a lot of people have asked me phosphatidylcholine. I think that there are some supplements that are important. I'm a big fan of magnesium. I wrote a book called Magnificent Magnesium, and I do think that people are not getting enough leafy green vegetables, and it is important to supplement with magnesium because it actually helps with energy in your body. It's got many other side effects. It helps to lower blood pressure, and it's got many other beneficial effects. It can help reduce headaches. It can help reduce muscle aches. It helps with the heart rhythm. So magnesium is one of my favorite supplements, and it's another way. You can also check your magnesium level if you're not sure. There's something called an RBC magnesium level, which you should tell your doctor, please check the RBC magnesium level. It's done at LabCorp. The serum magnesium level is not reliable as a marker for the amount of magnesium you have in the body, because only 1% of the magnesium that's in the body shows up in the serum. So check the RBC magnesium level. If it's below 5.5, you should definitely be supplementing. Vitamin D is very, very important. It's another supplement that you can easily have checked with your labs. Most doctors are checking vitamin D now, and if your level's below 30 nanograms per deciliter, you really should supplement with vitamin D. I like to keep the levels between 40 and 50 if I can. CoQ10, I think, is helpful. I told you about that. A multivitamin every day, if you're not eating enough fruits and vegetables, is very helpful. And of course, fish oils. And we have shown that folate, B12, and fish oils also help with maintaining telomere length and help with aging in terms of the brain. The brain relies on fats for development and for maintaining cognitive function. So DHA is very, very important and helpful. So I do put patients on fish oils as well. And those are the 5 that I like to think about and talk about. There are many other supplements. And as you've been told, there's lots of data, there's lots of information out there, and a lot of people making claims that unfortunately many are false. I think what you need to do, and you make sure that when you get your supplements, that you get them from reliable nutraceutical companies who actually do evidence-based medicine. And I don't want to name all the companies here on this podcast, but if you get in touch with Anya, I'm happy to send an email to people who ask me of which of the 3 or 4 that I use. So I'm going to end it there. Thank you very much for joining us tonight. And I want to just quickly tell you the date of the lecture that I was talking about on high blood pressure. Wednesday, March the 22nd at 5 p.m. will be all about blood pressure, maintaining a good blood pressure, and what you should be taking to keep your blood pressure down, and what you can do when it comes to healthy lifestyle and blood pressure. So let me end off by just saying that for me, the most important thing that we can do for prevention is to think about 4 things, and in fact 5 things. The 4 are nutrition, exercise and flexibility, stress management, sleep, and socialization. So focus on all those things every single day. Think about all those things. And that's the best way to prevent cardiovascular disease and other chronic conditions. So thank you for joining us tonight, and I look forward to seeing you at our next talk next month.